This session, we have the title called Acknowledging the Context. How do we achieve maximum impact? To follow on that theme, I think there are two main tasks we need to do. First and foremost, we need to look at what is the context and what are the reasons for these maternal and newborn deaths. And what does it mean to be living in a resource-poor setting, country, or what does it mean to be a practitioner in that kind of a setting? The second task perhaps we need to look at is, what do we mean by looking at ways of achieving maximum impact within this context? Well, I love cooking. I still remember when you make cookies, you have a cookie cutter approach. You just go bang, 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 bang. It doesn't work. It doesn't work in global health. What does that mean? We always talk about these things, but we never walk our talks. Maybe we can come back to that. So the notion of context specificity, no one size fit all. How does it apply at the country level? Now, in so doing, when we look at these two tasks, we also need to look at what is the potential of an integrated approach that tackles the multiple health problems. Because, somebody may be working in HIV/AIDS, others may be working in 2B, and others working in maternal and child health. But we all live in silos. That's the beauty, because that is quite narrow. We feel very comfortable, don't we? No? But can you imagine at the community level, you don't even have doctors, you may have a nurse, you may have a midwife. These people have to do everything. So what do we mean by integrated approach? We need to look at it from their lens. How can we people, whether at regional, global level, try to make things easier for them, making sure that, when we know all the causes, we know the solutions, and we know the cost-effective and methods that are working. But why aren't they delivered there? Now, we know very popular soft drinks, who shall remain nameless, and we know mobile phones, and I'm not giving any brand name. Why can they have that level of penetration? You may not have water and sanitation. You may not have electricity or a fridge that is working. But almost every village that I have visited in the last 3.5 years as DG of this organization, I always find a village with mobile phone. I always find a village with some kind of soft drinks. So what are the lessons we can learn from the private sector? Now, what is holding us back? I think we also have two big problems. When we talk about health, we always look at the issues from the health lens. We may need to go beyond that. First and foremost, I think what is holding us back is, number one, the low status of women. Women don't matter in too many countries and too many societies. When you begin to count women, especially maternal death, things will come around. The second issue is, whatever we are trying to do to improve maternal and newborn health, we need a well-functioning health system. What is health system? If Bill Gates said to me, Margaret, I don't really understand what you're talking about, then we fail as a community. If Bill Gates, such an intelligent man, doesn't understand what we meant by health systems, we have a long way to go. So how can we improve that? Of course, to people, health system can mean health manpower, health information system, logistics. Global Fund means something, Gavi another thing, WHO another thing. So how can we, friends, old and new, work together to get that health system running to serve women? I would like to make a few points. If we don't go beyond health and look at the social perspective, look at how can we reduce poverty, how can we reduce illiteracy, making sure we address nutrition and water and sanitation and filthy environments, I don't think we can get the kind of synergy and leverage we are getting. So, but are we prepared to do that? Are we still staying in areas where we feel comfortable, which we call health. Well, in order to do that, perhaps we need to also, I like to make 4 points. The first thing is, we have never had it so good. There's a lot of attention, shall I say, unprecedented attention to the importance of maternal and newborn health. And I like to thank many people in this room and beyond for doing what you're doing. For example, your contribution to the UN Joint Action Plan, your contribution to the Women Deliver Conference, and your contribution to this conference. This is an important movement that you are creating to bring to the world's leaders' attention the importance of maternal and newborn health. These are things that are lacking too far behind. The second point we must discuss is, what do we mean by strengthening health system? What does that mean? Again, the vertical, horizontal debate, we can put it to rest. And I want to recognize Jaime Sepulveda for his creative diagonal. That means we need both. We need the vertical elements, disease-specific program, but we also need the horizontal element, which we mean by at least healthcare workers, health information system. Do we have the right kind of health financing to make sure women don't have to worry about paying for the service at the point of use? So these are some of the issues. Now then, what about, what is the environment like, the debate between vertical and horizontal? I have to thank my friends in Global Fund and Gavi and other mechanisms. They are actually contributing in a big way to strengthening health system, and their boards have agreed to do more. Now, the third point I want to talk about is integrated approach. When we look at MDGs, for the global health community, we only look at MDGs 4, 5, and 6. Let me argue, all 8 MDGs are related. If you contribute to improving education of women, girls in particular, gender equity, nutrition, poverty reduction, the health will improve. So the interrelatedness and the interlinkage of the MDGs and even beyond, as I said earlier, if you don't look at, environment, you miss the ball again. The importance of water and sanitation. You don't need me to remind you how important they are. Last but not the least is my final point is, no country or community is too poor to start. You don't need to start from scratch. The smart thing to do is to exploit what already exists in your community, in your country, and move ahead, because we cannot wait. We cannot wait for donors to come along to build hospitals, to build roads. We need to do, while waiting for those support, we need to see in what way we can improve the health of women and newborn. Just give you a small example. Studies have shown that 137 million women of reproductive age have unmet need for family planning. If we satisfy this need and fill those gaps, studies have demonstrated that we could improve maternal mortality by 30%, and improve newborn mortality by 16%. And yet we are not doing enough in family planning. So that is just something, for us to think about. It is important, as Hans Rosling yesterday's presentation is so important, we must have the can-do attitude. But in order to do the can-do attitude, are we prepared to change our behavior? We talk about teamwork, we talk about collaboration, we talk about coordination, but I'm afraid it's all rhetoric. Or in WHO, I call it carbon dioxide, hot air. We are not walking our talk. And I guess if we can change our behavior and really think about that, we can make a lot of improvement. We must collectively remember the woman dying every minute because of childbirth, while we are still fighting each other. Duplication, competition. I've never heard a room so quiet. So that means, duplication and competition has traction with this group of audience. So let's go in and talk about these things. How are we going to improve this world collectively? Dybul, the Dybul I lead, I would like to be a partner and work with you and respect each other and move forward in the name of this world's citizens, particularly children, newborns, and women. And on that, I thank you.
As a business model, you've got to actually say there's an opportunity, but you have to be able to produce locally, to be able to afford that product locally. You've got to be a responsible employer. You're producing locally not to export to the rich countries, but to keep the products in the local markets. And then you need to also work in partnership. And I think the partnership, that goal 8, is something we shouldn't forget about, because people criticize this industry if we don't do something. But imagine if we start doing something and we don't do that with the guidance of WHO or neglected disease of the developing world, or with the Gates Foundation, or with governments. So this kind of partnership, I think, is extremely important to make sure that whatever we do is actually appropriate.
You never can get an economic model that works at primary care. Primary care is the duty of government. It has to be subsidized. We can implement it for them, but primary care is about investing in the country's most valuable resource, which is women and children, because that's the future.
One of the first themes that you really pointed out was buzzwords. We love buzzwords in what we talk about. Scalability, sustainability, big buzzwords today. In global health, some of the big buzzwords are health systems, maternal and child health. Fascinating, if you look 35 years ago, what were the big terms in global health? Health systems and maternal and child health. We also like our little cycles. So what we can do today maybe is move from that discussion, as you pointed on, and do something innovative in health and talk about the person at the end of the game and the purpose of a health system and the purpose of maternal health or child health, which is a woman and a child and a girl and a community, and focus on them and work back from that and ask, what do we need to bring them health and care for that person related to the MDGs, rather than focusing on a bunch of things that we want to do, focus on that person and move back from that.